Now, and there has been a paucity of evidence that this brain training does anything to improve cognition or affect age-related cognition or delay Alzheimer's type of cognition. And so this study was published by Adam Ghazali's group at UCSF 2 years ago in Nature, and it was very prominent because it was probably the first really good study addressing one of the key issues in this field. The big problem with cognitive training is it's been fairly obvious that if you sit in front of a computer and do a certain task over and over and over again, you will get better at it. But the big question has been, well, what's that got to do with real life? Does it affect other areas of cognition? If I get really good at this brain game on a computer, will I be any less likely to lose my car at the mall or forget to pay a bill or leave the stove on, or any less likely to develop cognitive issues? No one really knew that. So what they wanted to do is see if this training on this brain game that they designed would spill over or transfer is the key word here that the neuropsychologists use, transfer to other cognitive domains. Would it have a global or powerful effect on the brain? So they trained a group. These are people with just age-related cognitive function, not Alzheimer's disease. A third of them got trained to keep that car on the road. That's a single task of driving. A third got trained on the middle, the single task of responding to symbols that come up. These symbols were a command: press this button, do this. So you're responding to a symbol. That's a single task. And then the third had to multitask. This was the hardest one. They had to keep the car on the road and respond to these commands at the same time. So a much more challenging task. So what they did was they practiced this for 1 hour, 3 times a week for a month, this brain training exercise. And then they came back 6 months later and they underwent cognitive testing in other parts of the brain. And they found improvements in working memory and vigilance, 2 different areas of cognitive functioning, only in the multitasking group, only in the group that had done the hardest set of brain training. So there was some transfer of effect because doing these tasks did not require working memory, but yet their working memory got a little bit better. So this is really the first time that transfer effect was seen in a reliable study. But this is done in a laboratory setting, not in a home normal environment. So my understanding is they are working on a commercial version of this game. This is not commercially available. And we'll see what happens. This is just one study. In medicine, we like to see lots of studies saying the same thing. But that's pretty much it for a good evidence for a transfer effect. And it's just one small study. There has been so much marketed and sold. This has become a big business now, this brain training, that a group got together from many institutions. They happened to be meeting at Stanford, and they weighed in on this controversial area. This is what they said. Scientific evidence does not support the brain game claims, Stanford scholars say. 69 scientists at Stanford University and other institutions issued a statement that the scientific track record does not support the claims that so-called brain games actually help older adults boost their mental powers. We object to the claim that brain games offer consumers a scientifically grounded avenue to reduce or reverse cognitive decline when there's no compelling evidence to date that they do. So that's the conclusion as of late last year. I think that there might be some beneficial effects with the appropriate exercise, and I just think we need more research in this area. So I am open to some kind of effect with cognitive training, but I think we should just all be up to date that we have very little evidence at this point. My own personal hypothesis is that what benefits the brain the most is what I call cognitive engagement. Having a purpose and engaging with the most complex thing in our environment, i.e. a person. And I think there are benefits there, but we just don't have the research showing that yet. And I don't think this does much harm, but you can see we have very little evidence so far. Okay, what about diet and supplements? And And I'm actually going through what my patients ask me, what they would love to have a sitting at the computer solution. Most people would think that would be great. And the other very popular solution are supplements. If you could walk into GNC and prevent Alzheimer's, that's the way to go. So, any data for that? Thousands of websites for it, but any data for it? I'll review with you the Mediterranean diet literature, but I would encapsulate it by saying indirect evidence that we might be reducing risk by some 15 to 25%, those of us that can have enough willpower to stick to a Mediterranean diet. What about coconut water, coconut oil? I've been asked this more than 100 times. And I scour routinely for data there. There is no reliable data. A friend of mine at the University of South Florida, Dave Morgan's group, is doing a prospective study. No results yet, small study. We'll see if they get any signal of activity there. What about omega-3 fatty acids? That's a big one. And there have been several studies there, ranging in doses up to 1,000 milligrams twice a day. There have been some hints of effects here or there, but really there's just no overall significant effect in the trials that have been done so far. We'll talk more about that. Vitamin E has been all over the map. There was a New England Journal article in the late 80s that said vitamin E was effective in Alzheimer's. Then other studies couldn't reproduce that. There was a study last year that said there was people on 2,000 units a day of vitamin E had a 19% reduction in the rate of decline of activities of daily living. That made the news. However, when one reads that study, one finds there were no effects on cognition, no benefit effects on cognition, a core problem in Alzheimer's disease. Even worse, there was a study in the Annals of Internal Medicine about a decade ago. The patients on vitamin E supplement had a 10% higher death rates than patients that didn't take vitamin E. And I had one of my patients say, "Why are you killing me with the vitamin E?" There may be no free ride there with the vitamin E. What about vitamin D? That's a big one lately. It affects the immune system, cancer, heart health, everything. There are studies starting to emerge now, epidemiologic studies, suggesting that if one's vitamin D level is pretty low, less than 25, that's a pretty low value, that there might be roughly a twofold risk of getting a dementia. So that's just an epidemiologic study. It's not testing moving forward. So it'd probably be a good idea not to have vitamin D levels. And most of the primary care physicians at this point, most of the internists will get vitamin D levels on people. As we stay out of the sun, our vitamin D levels go down. And then finally, turmeric, curcumin, that's been discussed for a long time. And I've been told over and over again that they get less Alzheimer's in India. So I tried to track down the study or studies that showed that, because I've been cited that so many times. I finally found in some obscure journal somewhere that somebody had done this little epidemiologic study in some small village in India that had that as a conclusion. That's it for a country with 1 billion people. And with all the other factors ignored. People might walk more, get more exercise, be less overweight. The other aspects of the diet are different. It goes on and on. The demographics are different. Anyway, we don't want to miss anything. A group at UCLA that was really passionate about curcumin and Alzheimer mechanisms, had worked for years in it in mice, did a clinical trial, and it was completely negative. As far as we know, curcumin doesn't get through the blood-brain barrier very well, although people say when it's cooked in Indian food with the correct oils and stuff, it does. But I would just say right now we have no evidence for it. I love eating it, but we don't have any evidence for it. Okay, back to the omega-3 fatty acids, and here's a cautionary note. You might say, okay, it won't do me any harm, I'll take some fish oil pills. There have been, I think it's 4 studies so far, that in men, the people that have high omega-3 fatty acid levels, generally from supplementation, have a 40% increased risk of prostate cancer. So you don't necessarily get a free ride with these benign sounding supplements. And this has come from different groups, different studies, so it might actually even be true. So I think it's just a cautionary note that delaying or preventing Alzheimer's may not be as simple as a nutraceutical. And nothing is necessarily safe in my mind. There are always risk benefits. Here's a cautionary note on omega-3 fatty acid supplementation. So just to summarize Mediterranean diet, because I think if there is some effect there, it's the overall diet rather than trying to take pills. And this is a complicated slide, I'm sorry, but I just wanted in your handout to list the actual studies. These are recent reviews. Here's one in 2014. They looked at 6 longitudinal studies. These are studies where they follow populations over time. And 5 of the 6 showed a lower Alzheimer's risk on people that adhere to a Mediterranean diet. 2 out of the 3 showed reduced conversion from mild cognitive impairment to Alzheimer's of people who are on the Mediterranean diet. There's only been one prospective trial where they take a group and put one group on the Mediterranean diet and one not. That only lasted 4 weeks. They had some improved, what they call biomarkers, various measures, and some improved visual memory. A second article in 2013 reviewed 11 what we call observational trials, one randomized clinical trial. There have been 2. And they did find some lower rates of cognitive decline in Alzheimer's risk in 9 of the 12 studies. The effects on MCI were not consistent. And finally, in the third one there in 2010, they looked at 7 longitudinal studies where people were followed over time. And people, they have, there's a point system that measures somebody's adherence to a Mediterranean diet. You can be really well adhered or medium adhered or poorly adhered to your Mediterranean diet. But for every 2-point increase in your adherence to a Mediterranean diet, you had 13% less risk of any neurodegenerative disease. And finally, on the bottom there, another study looking at 5 longitudinal studies. People in the top tertile of Mediterranean diet adherence had 20% less chance of getting MCI and 36% less chance of Alzheimer's. So overall, my summary of reading through all of these papers is about a 20% roughly, ballpark idea, risk reduction in people adhering to a Mediterranean diet. This is hard to study. I think all of us need to understand the difference between a retrospective epidemiologic study and a prospective randomized study. Does everybody know the difference between those two? 99% of what we see in the news are association studies where people that say do something or on a Mediterranean diet have less something. There's an association between Mediterranean diet and say less Alzheimer's. Associations can be deceptive and tricky because maybe the people on the Mediterranean diet are doing something else also. Like maybe people on Mediterranean diet exercise more or something. And it's the something else that's lowering the Alzheimer's risk and not the Mediterranean diet. So these epidemiologic or association studies don't tell us about cause and effect, but they're easier to do, and that's what's in the news. A prospective trial is much harder, much more expensive to do. That's where I say take this half of the room, moving forward, for the next 3 years, you stay on a Mediterranean diet. This half of the room, for the next 3 years, you have to go to Burger King and McDonald's 3 times a week. Okay? And then everybody come back 3 years from now, and let's see how you're doing. And we're going to make sure before this trial starts that the smoking rates, exercise rates, diabetes rates, hypertension rates are equal between the 2 sides of the room. That's called a prospective trial, difficult, expensive, and in some areas like Mediterranean diet, really hard to do. Can I really convince you to not eat well for the next 3 years? And are you guys going to really stick to this Mediterranean diet for the next 3 years? That's a hard trial to do. And that's why our data is so limited. That's why we're limited to these association trials that we always have to be careful about. What about exercise? We have about 10 more minutes to go. Let's look at an effect of exercise here in just normal older people on hippocampal atrophy. So the hippocampus part of the brain critical for establishing new memories